Um, so rural women in Illinois deserve to have healthy opportunities before, during, and after their pregnancies. In Illinois, 62 of our 102 counties are considered rural, and 11% of our population lives in those counties. This means that they have smaller population sizes and it have less access to resources that we're accustomed to in urban areas, such as healthcare clinics, grocery stores, and other resources. In fact, in Illinois, 60% of counties do not have a hospital with obstetric services or a birthing center, which means that for individuals living in those counties, if they want to give birth, they need to travel to another county. I've recently been talking to pregnant women living in rural communities to understand their experiences and learn what would help them to have healthy pregnancies and beyond. Recently, I met Jordan, who lives in Southern Illinois. Jordan already had high blood pressure when she became pregnant. And high blood pressure in pregnancy can cause complications both for her and for um, her fetus. So she ended up having to spend a week in the hospital during her second trimester because her blood pressure was too high. And while she was at the hospital, she was counseled on eating more vegetables and less processed foods. And she developed a love of avocados. So I've been to the town where Jordan lives, and there's no grocery store in her town. So I asked her, where do you get avocados? Because there's no grocery store in your town. And she said, well, the closest grocery stores require at least a 30-minute drive, which makes it really hard to stick with those vegetables if you have to drive 30 minutes at least to get to the grocery store. I also recently met Jessica, who lives in central Illinois near the Mississippi River. Jessica has to go to St. Louis for her prenatal care. And because of where she lives in central Illinois, requires a ferry journey across the Mississippi River. So the ferry is $17 round trip, and it takes 2 hours each way, plus the stop for gas. And so, if you add up the cost of travel and the ferry and gas and time, there's not a lot of time left. Jessica works part-time and has a son who's a toddler. And so there's not a lot of time and energy left for self-care. So more and more women of reproductive age are developing chronic conditions like obesity, diabetes, and high blood pressure. Obesity puts women at risk for diabetes, and then developing diabetes during pregnancy can cause complications such as miscarriage and stillbirth. Women who develop diabetes during pregnancy are also at risk for developing type 2 diabetes later in life. And then high blood pressure can have serious life-threatening consequences for women during pregnancy and after, as well as for the infant. And these complications are all connected. Those who have obesity are more likely to develop high blood pressure and diabetes. And if you have diabetes, during pregnancy, you're more likely to develop high blood pressure. So we really need to address the issues. And in rural areas, it's particularly challenging due to the access challenges with healthcare clinics, lack of difficulty with physical activity, because often rural areas lack sidewalks, streetlights, and fitness centers. And often rural areas lack pregnancy support services and childcare classes. So what can we do about it? Oh, and rural areas also often lack the technology infrastructure that we're used to in urban areas. So a lot of women that I talk to don't have cell phone service at home or don't have access to the internet at home. So my goal is to set rural women on a path to healthier lives, starting with physical activity. However, in my prior work with rural communities, I found that women are often burdened with a lot of different responsibilities. They often work outside of the home. They are responsible for childcare and chores around the house, and also are often volunteering in their churches and their communities. So there's not a lot of time and energy left in the day. However, pregnancy is a time when women are taking care of themselves and also thinking about the health of their baby, and they're often engaging more with the healthcare system. So why physical activity? Physical activity is recommended for most pregnant women, and it has benefits during pregnancy, during labor and delivery, and in the long term. It doesn't have to be strenuous and can include activities like walking and light stretching. So, in order to address this need in Illinois and beyond, I am trying to talk to rural women to learn how to help them meet their health needs. And thus, I need your help to reach out to rural women, and that will help me tailor programs to take what we know from working with pregnant women in other research settings to bring that knowledge to rural communities in a way that fits.
Thank you so much, Chris. Thank you.